السلام عليكم اخواني واخواتي اطباء الاشعه والاطباء من باقي الاختصاصات. انا دكتور احمد ضياء عبدالوهاب، اخصائي الاشعه التشخيصيه. اليوم قررت انه ابدا وياكم سلسله جديده من المحاضرات، سميتها هايلايتس ان راديولوجي HIR. اليوم راح تكون ابيسود 1. هايلايتس ان راديولوجي بشكل مبسط هو حلقات لا تتجاوز من 10 إلى 20 دقيقة لكل حلقة. بكل حلقة راح ناخذ موضوع واحد وراح نقدمه لكم من ناحية radiological point of view، وراح نحكي بشكل مبسط ومختصر عن هذا الموضوع. اللي أطلبه من حضراتكم أنه تساعدونا بالأشياء التالية. أولا، اشتركوا بالقناة وفعلوا جرس الإنذار حتى أي حلقة تنزل رأسا تقدرون تشوفوها. ثانيا، شاركوها ويا أصدقائكم وخلوا أصدقائنا من باقي الاختصاصات يتعرفون على قناتنا في سبيل أنه نتطور ونستمر ونقدم محتوى أحسن. أهم شيء تسووه، أريد منكم تفاعل في أنه بالتعليقات تعرفون رأيكم بالحلقة، بطريقة التقديم، بالصور. إذا عندكم أي نقد بناء في سبيل نطور من أداء الحلقة يعني نطور من أدائنا في الحلقات القادمة. وإذا عندكم أي موضوع حابين نحكي عليه بهاي الطريقة اللي راح نقدمها هسه، يا ريت تشاركوها وياي بالتعليقات حتى نقدر نحضرها ونقدمها لكم في الأيام القادمة إن شاء الله. فأول حلقة من Highlights in Radiology اختارينا موضوع راح يكون I think إنه interesting، اللي هو Craniosynostosis. Craniosynostosis كديفينيشن هو عبارة عن premature fusion of the cranial suture. الكرانيال سوتشرز تصير فيوزد قبل الوقت المحدد، وبالتالي it can fuse single suture or in combination multiple sutures، وكل طريقة فيوجن راح ينتج عنها abnormal shape of the skull. So as a rapid let's say introduction to the topic, these are the cranial sutures. We have the coronal suture here, we have the metopic suture, the sagittal suture, and the lambdoid suture. So if you can see the coronal suture, it separates between the two frontal bones and the two parietal bones, while the sagittal suture separates the two parietal bones from each other, and the lambdoid suture separate the two parietal bone from the occipital bone. Also, don't forget the metopic suture here, which separates the two frontal bone from each other. Also here we can see this is the coronal suture separating the frontal from the parietal bone, and this is the lambdoid suture separating the parietal bone from the occipital bone. So these are the cranial sutures. So regarding the craniosynostosis, the causes of the craniosynostosis includes common causes and uncommon causes. So regarding the common causes, we have the most common is congenital syndromes and bone dysplasias. These are very common causes of craniosynostosis. Also, in cases of decreased intracranial pressure like cerebral atrophy, shunted hydrocephalus, what we call contracting skull. The skull is getting smaller and is contracted. Also, a very common cause is primary or idiopathic craniosynostosis. These are the common causes of craniosynostosis. What are the uncommon causes of craniosynostosis? They include anemias like sickle cell disease, thalassemia, and iron deficiency anemia. Also cretinism. Cretinism is congenital hypothyroidism. It's fatal if untreated, so it should be treated, cretinism. Also hyperthyroidism and hypervitaminosis D. Microcephaly, which is due to failure of brain growth, can cause craniosynostosis, and also polycythemia vera, and rarely rickets in certain types like hypophosphatemic rickets or vitamin D resistant rickets are uncommon causes of craniosynostosis. So now, what is the classification of the primary or the idiopathic premature craniosynostosis? There are different types of craniosynostosis as been highlighted here. You can see we have the brachycephaly, the microcephaly, the oxycephaly, plagiocephaly, scaphocephaly, trigonocephaly, and trilobarcephaly. And we will talk about each and every one of these in short in the following slices. So let's start with the brachycephaly. Brachycephaly is basically bilateral coronal sutures. The coronal sutures are fused, both of them, and this will result, the coronal suture puts bone in an anterior and posterior direction forms bone. So there is no bone formation anteriorly or posteriorly. Only the sagittal suture is working, expanding the bone laterally. So there will be short, wide, slightly high head with what's called harlequin orbits. Harlequin orbit, harlequin means clown, مهرج. كلمة harlequin معناها مهرج or clown. So the orbits will be like that, like a clown, and it's due to bilateral coronal suture fusion. So what will happen there is there will be this abnormality here. You can see the coronal sutures are absent, so the bone is not formed in these directions. It's formed only in from the sagittal suture, which is in this direction. So the head will be like this. Will be this is the normal head, and this is the brachiocephaly. The head is wide and short, okay? And as in this baby, we can see here the head is wide and short, and you can see the orbits here, harlequin. It's elevated like a clown. So what do we see in radiology? We can see the following things. If we just clean the screen, and in the X-ray, this is the lateral skull X-ray. Of course, here we don't see the sagittal suture because the sagittal suture is located somewhere around here. The coronal suture is completely absent. There is no coronal suture, indicating a brachycephaly. Now, also we can see in the CT scan, there is in the bone window, of course. In the bone window, we can see this should be the coronal suture here, and they are absent, while the sagittal suture is present. So we see the presence of the sagittal suture while the coronal sutures are absent and not present, as you can see. Now, regarding MRI, basically the brain will be of normal structure, should be normal as formation or structure, because it does not affect the brain itself. But what will happen is that we can see the skull itself, the skull vault is wider than long, and this is a case of brachycephaly. Now, for the second kind of craniosynostosis, we will talk about microcephaly. Microcephaly, basically, it's a small round head. Micro, small and round head, and this happens because all the sutures, or universal craniosynostosis, all the sutures are fused, okay, prematurely. So what does that mean? How does it look? This would be the normal shape of the skull. However, since all of the sutures are closed, this will be micro, small brain, and the baby would look something like that. This poor baby with the beautiful eyes. However, in the X-ray, we can see that the skull is of abnormally small size compared to the rest of the face. The facial structures are normal while the skull is small in size. And what do we see in the CT scan? We can see that basically there is no sutures, not coronal, not sagittal, not lambdoid, nothing there. But what are these things at the arrowheads? These are prominent parietal foramina. We have prominent parietal foramina. And why do we have prominent parietal foramina? Due to increased intracranial pressure that will enlarges the parietal foramina as a compensatory mechanism. Okay, so we have prominent parietal foramina in cases of microcephaly. What about MRI? What does it look like? First of all, let's see the 3D reconstruction of a microcephaly skull. You can see easily the prominent parietal foramina here and there. In the MRI, we will have, this is the normal brain of the normal patient in the same age, while this is the microcephaly brain. The microcephaly brain is basically much smaller in size, just microcephaly. Now, also this is the sagittal images of, just let me clear the screen, the sagittal images of a microcephaly. You can see the skull vault is way smaller than normally what it should be. Again, this is a case of microcephaly. Now, the next type is oxycephaly. Oxycephaly, ox means bull, thor. So oxycephaly is bull-like head. It's like the shape of the head of a bull. there will be tall, okay, there will be tall, wide, short head, or what's called trilobarcephaly, tower shaped. Trilobarcephaly like tower, it's like a tower, okay, مثل اللي لابس طربوش. Pointed head with overgrowth of the prigma with flat underdeveloped lower posterior fossa. So the posterior fossa is underdeveloped and flat, and there is a tall head. Why does that happen? Because there is bilateral lambdoid and coronal. So there's only sagittal suture. The lambdoid and the coronal sutures are fused. Lambdoid and coronal sutures are fused, and only the sagittal suture is present. So what do we have here? We have the coronal sutures fused, the lambdoid sutures fused, while the sagittal suture is not fused, forming bone, and this will result in tall head with flat occiput, okay? And the shape of the child head would be something like that. It's terrifying, unfortunately. You can see here the head is tall while the occipital region is flat, and the x-ray of the patient will be just like that: tall head, flat occiput, and there is no coronal suture and no lambdoid suture because they are fused, because this is a case of oxycephaly. The 3D representation will be something like that. You can see there is no coronal suture here. And we can see the CT scan in the bone window. You can see also there is no coronal suture, while some remnant of the sagittal suture is still present here. And you can see also in the MRI, this what will happen. The brain will be very much elongated due to the flat occiput, lack of lambdoid suture, and no coronal suture, so the brain will be just like that, elongated, okay? Now, the other type of craniosynostosis is plagiocephaly. Plagiocephaly is a very common type of craniosynostosis. I think it's one of the most common types of craniosynostosis. There will be oblique asymmetrical head. It's obliquely and asymmetrical. Why is that? Because one side of the coronal suture is fused. Only one, either right or left, coronal suture, and there will be flattening of the ipsilateral frontoparietal legion and elevation of the ipsilateral sphenoid wing and unilateral halariquine and orbit or lambdoid suture fusion. What do we say halariquine means? Elevated orbit like a clown, مثل المهرج, okay? And you can see this is what will happen. Everything looks normal except this is a coronal suture, while this one is not present. So this is flattened and it's asymmetrical, just one side. And we can see here the shape of the baby skull. For example, here this part is fused, the lambdoid suture here, only one side of lambdoid suture, so this is posterior plagiocephaly, while in brachycephaly, if you remember, both sides are fused. So basically plagiocephaly is unilateral brachycephaly. It's brachycephaly on one side only, okay? And what we will see in the baby's head will be something like that. The head is flattened on one side. Sometimes can be positional due to patient or baby always lying on one side. The head will be flattened on one side like that. And the x-ray will show us here, there is very obviously seen, there is a coronal sagittal, while here there is only lambdoid, there is no coronal suture, so we have unilateral plagiocephaly. And in the CT scan you can see again there is a flattening on one side due to absent coronal suture on that side, while in the MRI images you can see again the brain structure basically is normal. The brain structure is normal, however it's flattened on one side due to unilateral plagiocephaly. So let's see other type of craniosynostosis, which is the scaphocephaly. Scaphocephaly is a long, narrow, boat head, or what's called dolichocephaly, long, slightly high head. It's due to the sagittal suture craniosynostosis. The sagittal suture is prematurely fused, so there is no expansion in lateral direction, there is only expansion in antero-posterior direction, and that's what we call scaphocephaly. So this is what happens. The sagittal suture is not present, only coronal and lambdoid and and metopic and lambdoid suture, and this will result in the brain being something like that, tower shaped or elongated or whatever you want to call it. So what does that mean? The baby's head will be like that. It's narrow and it's tower shaped, okay? And the x-ray will show us that in the lateral view the head is way too elongate in the anterior-posterior direction, because the coronal suture is present, the lambdoid suture is present, and they are forming bone in this direction, while the sagittal suture is not present. You can see here the sagittal suture is fused and not opened, and this is what we call scaphocephaly. So let's see the CT scan on the 3D representation of the patients. You can see the sagittal suture here is absent, and you can see coronal and lambdoid are open, and the result will be in a anterior-posterior elongation of the patient head. You can see the brain is basically normal, but the shape of the head is way more long than short. So this is scaphocephaly, and in the MRI, this is the 3D representation again, and in the MRI you can see the brain structure is normal, but the head is much longer than wide. So it's the opposite of brachycephaly. Scaphocephaly is sagittal suture fusion, while brachycephaly is coronal suture fusion. The other type of craniosynostosis is trigonocephaly. Trigonocephaly means triangular head. Trigono means triangular. So triangular head. It's narrow in front and broad in the back with hypotelorism. What does it mean, hypotelorism? Means the eyes are close to each other. Close eyes to each other. So this is a hypotelorism. And why does that happen? Because the metopic suture is fused. Metopic suture will be fused. So as we can see here, the metopic suture is not present, only coronal, sagittal and lambdoid sutures are present, while here the metopic suture is not present, and this will result in the triangular shape of the anterior part of the skull while widened posteriorly, and this is called trigonocephaly, and the patient head will be something like that. It's triangular in shape like this, and you can see the eyes are close to each other. This is called hypotelorism. Okay, it's triangular shaped head, hypotelorism in trigonocephaly. And you can see in the x-rays the metopic suture here, it's not seen. The metopic suture is not present. Okay, and the eyes are way close to each other because of hypotelorism. You can see here. Okay, now in the CT scan, again, just like the image here, you can see it's triangular in shape, wide in the back, and in the bone window there will be no metopic suture. And in the 3D representation, again, you can see, just let me clean the screen from all these lines. You can see this is the normal skull, this is the metopic suture. Normally here there is no metopic suture, so it's a triangular shaped head, and you can see the normal distance between the orbits, while here the orbits are way close to each other. It's a hypotelorism due to the trigonocephaly. And in the CT scan, in the MRI, you can see the triangular shaped skull, while the brain basically underlying it is normal, underlying brain. The last type of craniosynostosis that we will discuss here is what's called the trilobarcephaly. And if you notice, tri means three, philo means phylum, waraqa, leaflet. So it's the head with three leaflets. And this, what does that mean? It's what's called clover leaf skull. Clover leaf skull. And well, clover leaf skull, in German it's something which I cannot even pronounce, Klebelstadel anomaly or something like that. It's trilobar skull, three leaflets. It has frontal temporal bulges due to intrauterine premature closure of the sagittal, coronal and lambdoid. So all the sagittal, the coronal and the lambdoid sutures are closed However, the key word here with hydrocephalus. When there is hydrocephalus and the sagittal, coronal, and lambdoid sutures are closed, the skull bones will bulge because of the increased intracranial pressure. So first of all, the clover leaf is this one. This is the clover leaf, and you can see it has 3 leaflets, so it's trilobed skull. So what would the baby look like? What would be the shape of the head? It will be like that, tri-leaflet or trilobar or clover leaf. Due to fused coronal and sagittal suture, increased intracranial pressure will push, due to the hydrocephalus, will push the bones from all sides. Now, this will be the shape of the skull of the bone. You can see the 3 leaflets, and this is a lateral view, of course. And in the CT scan, also it's very obvious, 3 leaflets due to the fused sutures. And in the MRI, the key word, as we said, is hydrocephalus. So you can see there is obvious hydrocephalus pushing on the bones on all sides. So let me draw it again, maybe you can understand it even better. So it's pushing on the brain from all sides, okay, like that, and resulting in what's called cloverleaf skull, like that, okay. So this is a quick demonstration of different types of craniosynostosis. We have positional plagiocephaly, we have the posterior plagiocephaly, this is the absent, the lambdoid suture. Also anterior plagiocephaly, the coronal suture is absent. We have the brachycephaly, when both coronal sutures are absent. We have the trigonocephaly, where the metopic suture is absent, and we have the scaphocephaly, where the sagittal suture is absent. And this is the normal skull with the metopic, coronal, sagittal, and lambdoid sutures are present. هذه كانت الحلقة الأولى من Highlights in Radiology. لا تنسون تشتركون بالقناة، تخبرون أصدقائكم علينا، وخبروني رأيكم، اكتبوا لي رأيكم بالحلقة بالتعليقات، وإذا عندكم أي مواضيع تحبون نقدمها بهالأسلوب بالحلقات القادمة. أنا دكتور أحمد ضياء، وهاي Highlights in Radiology. شكرا.